Okay, we are live. Hi, welcome back to This Week in Global Health. This is a live Global Health News Roundup. We broadcast every Wednesday at 7 o'clock GMT and at some other time in different parts of the world. Today's Wednesday the 12th, 2014. My name's Greg Martin, and we are doing access to medicines for the whole of the month of November. Tonight's episode is going to be about research and development, and specifically the gaps in research and development that are really contributing to the barrier to access to medicines all over the world. Before we carry on, I'm going to ask the panel members to introduce themselves and tell us a little bit about what they're going to talk about. My name's Greg Martin. I'm going to be talking about neglected tropical diseases. Next up, Jessica, talk to us. Who are you? What are you going to talk about tonight?
Hi everyone, I'm Jessica Taff, and I'm coming to you from the Washington, D.C. metro area where it is 2 p.m. And today I'm going to tell you about a little bit of an overview of what the research gaps, research and development gaps are in terms of funding, research, and that also includes public health and implementation research, and some of the solutions to this that can enable better access to medicines.
Thanks, Jessica. Next up, Christy. Christy, where are you? What's the time there, and what are you going to talk about today?
Hi everybody, I'm Chris Ronson. I'm coming to you from San Francisco, California, where it is finally cold and it is 11 in the morning. I will be talking to you today about the MSF Access Campaign and one of their more recent documents that highlights the gap between medicines and access.
Thanks, Christy. Next up, Katie. Katie, talk to us.
Hi everyone, my name is Katie Jackson. I'm actually today coming to you from Ottawa in Canada, where it is very cold. And today I'm going to give you a little update on Ebola, and then I'm going to talk to you about a mentorship program that I think everyone will be interested in.
Excellent, exciting stuff, Katie. Next up, Sulzan, talk to us. Or Sulzan, I think I said it wrong. Talk to us, Sulzan.
Hey everybody, I'm Sulzan Bali, and I'm coming to you from Durham, North Carolina. It is 2 p.m. here, and I'll be talking to you about research and development gaps in antibiotics and vaccines.
Thanks very much, Sulzan. And then our good friend Brian from Johns Hopkins.
Hi, everybody. I'm Brian Simpson from Bloomberg School of Public Health here at Johns Hopkins and Global Health Now. It is 2 o'clock in Baltimore, and I'll be talking today about the two of the top global health news stories.
Okay, and if you don't know about Global Health Now, we'll tell you a little bit about it later. But Global Health Now is a newsletter that goes out not once a week. It goes out. Brian, when does it go out? Every day?
Every weekday. Every weekday. We take the weekends off here. Okay, we're lazy.
Okay, and we love Global Health Now. It's a fantastic resource. Okay, a new member to the group, Gloria. Gloria, talk to us. Who are you, and what are you going to talk to us about today?
Hi everyone, as Greg said, I'm Gloria Tavera. I'm here in Cleveland, Ohio at Case Western Reserve University. I am an MD PhD student, again with UAM. I'll be talking to you today about the university's Allied for Essential Medicines annual fall conference and also a little bit about what essential medicines are.
Thanks very much, Gloria. Now, for those of you that haven't been with us before, let me just quickly tell you, if you want to get the show notes, and the show notes will include all the links and the URLs to all the web pages that we talk about, etc., you can subscribe to our newsletter, and you can do that at our webpage, www.twig.org, and at our webpage you can also find out more about our podcast. We've got a podcast that goes out after the show. It's the audio version of the show. We've also got a blog, and we'd love people like you out there to contribute to the blog. So if you're an aspiring blogger or you'd like to write, or if you're a student that's constantly doing assignments for your MPH degree and you want to put those assignments somewhere out there and get a bit of visibility, contact us via the blog. That'll be exciting. We also want to, and this is quite exciting, we want to welcome our new audience in China. So until now, we haven't been able to access China because you can't watch YouTube in China, but we've found a way around that. And so welcome to anybody that's watching this from China. Someone in our panel can say hello in Chinese.
Ni hao.
Thanks.
Okay. You do that so enthusiastically, Sulzan.
Okay.
Good job.
Well,
Wait, can I
well
just
done.
say? Can I just say? Because you're talking about the bloggers, I want to say thank you to the people that we've had blogging for us already. We've been having a lot of them, and that's been so great to get fresh voices and contributing to our community here. Thank you, guys.
Absolutely. And I think that's the point. What we're trying to do here is develop a community. We're not just trying to broadcast, but we want you to feel part of this whole process. Right, we're going to jump right in, and we're going to ask Brian to give us an update. And these updates, by the way, come from the Global Health Now newsletter. So these will be things that Brian will be making reference to that. Brian, over to you.
Absolutely. So our first, the top story I saw this week, and always up for debate, but this is what I'm calling, is the report this is from the South China Morning Post about the mortality due to premature deaths due to exposure to smog and fine particulate matter pollution. We're looking at 670,000 premature deaths in China alone in 2012 due to these fine particulate pollutants. And so this is leading to premature death from coronary heart disease, from lung cancer, strokes, and chronic obstructive pulmonary disease. So just when you see a statistic like that and a number that's just quite shocking, rather than just seeing the images you do frequently of Beijing in terms of the smog and everything like that. This puts like a very serious number to that. The good news is it's somewhat leavened by the news from this morning that China is going to commit to, by 2030, no longer increasing its carbon emissions by 2030. So there seems to be some recognition of the issue and a little bit of progress, but certainly a lot of work to do.
Brian, that's very interesting. And a small little jump right in.
I would love to talk. Sorry, just a little point there. I would love to talk more about basically the smog situation in China in the discussion later on. I have some interesting input which I'd love to share.
Oh,
okay,
great.
Brilliant. And just so that if you're watching this live, you can tweet us your comments and questions, and we'll deal with them at the end of the episode. So just tweet us with the hashtag Twig, or you can send a message through our webpage, or if you're watching this on Google Plus, you can just stick it in the comments below. Right, a little factoid on respiratory disease as a result of pollutants. More people die from respiratory disease related to the inhalation of pollutants globally than as a result of HIV, TB, and malaria put together. Which, when I read that, I was quite startled.
Wow, serious numbers there. So on to our second sort of top story for global health this week, and this is not an earth-shattering story, but I think it's something that's really important that certainly merits more discussion, and it's an editorial by Victor K. Barbiero from Global Health Science and Practice Journal. And Victor is talking here about comparing sort of the concerns in reaction to Ebola and the need for strengthening health systems. It's sort of a basic fundamental issue that has not gone away. He says that the stressing sort of the vertical approach to things in terms of focusing in on specific diseases, whether it's from smallpox and its eradication or polio, malaria. These things have drawn a lot of attention, a lot of funds, and a lot of focus, but some of the basics are just not getting covered in terms of health systems and strengthening the health systems. And the Ebola outbreak certainly has pointed to the issues in West Africa and the shortcomings there in terms of some of the basic treatment. And he reminds us with the statistic that every year, 66,000 children die from diarrhea every year, and so there's some of the basic issues that aren't being addressed. And I think this to me is just an important issue that's just not going to go away. The public can focus on something like Ebola, and it's a serious issue, but sort of there's a larger issue out there that we all need to be concentrating on.
Absolutely, and just so that people know, we're going to use the month of January to focus on health systems. So each episode in January, we're going to do 4 episodes all about health systems. We've done one already, but we're going to go back to that because there's so much to cover. So watch this space.
Yep. Mm-hmm. Yep. And with that, I'm going to go ahead and pop off. I'm just jumping in here to give a little brief of bit of news. And I do want to correct one thing. I misspoke. It's 66,000 children die every month from diarrhea.
Wow.
Right.
Wow.
Yeah.
So,
Yeah. It's absolutely phenomenal.
Important correction.
Yeah.
Okay.
Brian,
Okay. Great. All right.
Brian,
Thanks, Brian.
there's a picture behind you. Is that Sanders from Kentucky Fried Chicken, or is that somebody else that's related to public health?
This is William Henry Welch, and I put him back there purposely so we could talk about it. William Henry Welch is the first dean of the School of Public Health and the School of Medicine here at Hopkins. So I've got him back.
Good-looking guy.
And they called him Popsy. So
Okay.
Right.
He's a legend around here, and he's sort of overseeing everything I do now.
Well, please bring him on the show again.
I will. Well, I'll have him talk next time.
Thanks very much, Brian. Great to have you on the show, and we know you've got to go, but thanks for your time.
Thanks so much. Yep, we'll see you.
Okay, next up, Katie. Katie, you're going to talk about a news item on Ebola, and then we're going to jump right into all the health access to medicines issues.
Yeah, just another news item. I know that Ebola is definitely on everyone's mind. From my point of view, I think it's interesting that now it's transcending into different sectors. So right now, Morocco has dropped out as a host for the Africa Cup of Nations due to Ebola fears. Ebola has not actually been detected in Morocco yet. This is the fear of the country of Ebola coming into it. But also none of the three most affected West African nations by Ebola, that's Liberia, Guinea, and Sierra Leone, have actually made it into the finals for this tournament. But they are saying that they don't want Ebola into their own country. It's really interesting what other African nation will host this. That'll be coming soon.
It'll be interesting. It'll be interesting to see what other countries decide to do, if they'll follow in what Morocco's decided to do.
It's really sad that this is happening, and I just want to point our viewers to several episodes ago, we talked a lot about the Ebola fears that were happening in the U.S. and Europe, and now we can see that it's going into Africa, and that's unfortunately really disappointing.
Yeah. Well, hopefully we'll have this all behind us before we know it. So we'll just keep an eye on all of that. Okay, very good. I'm going to talk a little bit about neglected tropical diseases, because when we're talking about access to medicines, and the term neglected tropical diseases, the word neglected is in there for a reason, and that's because either these are diseases for which there are not adequate treatments that have been developed, or there are treatments, but we're needing better treatments and treatments that can be used for children, etc., etc. Or medicines exist, but we're just not getting them to the people that are sick, and it's a terrible travesty, and we'll talk about a little bit more about that now. And we're talking about R&D, research and development today. So, of the 1,556 new drugs that were approved between 1975 and 2004, only 21 of them, that's 1.3%, were specifically developed for tropical diseases and tuberculosis. And that's despite the fact that those diseases account for 11.4% of the global burden of disease. So it's just a striking imbalance between where the burden of disease is and where the money is going in terms of R&D for treatments and therapies.
And really quick, just to butt in, Greg, we do have updated numbers as well. Since people have started to sort of try tackling access to medicines, we've seen a little bit of an increase, but neglected diseases still have a global burden that accounts for like 10.5% of the disease issues, and yet only 3.8% of the drugs developed between 2000 and 2011, and only 1.4% of the registered clinical trials were actually geared or broached the topic of neglected diseases. So still a lot of work to be done.
Right. And of course, there are organizations like DNDi that are doing tremendous work in terms of developing new and important therapies for people that are suffering from these diseases.
Oh, definitely.
And I would just add in there, those who are interested in the research on neglected tropical diseases, since Gates has come in and the newfound interest in global health and tropical diseases has come in, GFinder is a resource that's been developed that you can actually follow the investment of over the past several years in many neglected tropical diseases. Unfortunately, some have received more funding than others, and unfortunately some, especially many of the parasitic diseases, funding has even stagnated in the last few years. And of course, we have to be reminded that many of the people in these countries are not only now having tropical diseases, but a double disease burden of non-communicable diseases on top of those tropical disease burdens. So just a very interesting overlap.
Very interesting indeed. Okay, so now people often don't know, when we talk about neglected tropical diseases, people are often very unsure, but what are these diseases? And I'm going to give you kind of a 30-second overview. I'm not going to go through all of them. There's about 17 diseases that the WHO have classified as neglected tropical diseases. I'm just going to talk about a few of them and give you a heads up as to what they are, what they do to people, and what the burden of disease is that is a consequence of these illnesses. So first off, we've got African trypanosomiasis, right? This causes sleeping sickness, and it can also kill people, and there's about 20,000 cases annually. Then there's Chagas disease. Now, Chagas disease has been in the news recently because we're now conscious of the fact that we're seeing it in the United States. This is actually otherwise known as American trypanosomiasis, and it causes fever, facial edema, which is swelling of the face, hepatosplenomegaly, which is basically swelling up of the liver and the spleen, cardiomyopathy, which is an inflammation of the myocardium or the heart muscle, lymphadenopathy, big lymph nodes, and of course death. Now there's about 8 million people worldwide that are suffering from Chagas disease, and there's about 10,000 deaths annually from Chagas disease. Then we've got visceral leishmaniasis. This causes fever, hepatosplenomegaly again, weight loss, anemia, and death. there's about 300,000 cases annually and about 20,000 deaths annually. Then we've got lymphatic filariasis. This is otherwise known as elephantiasis. It's caused by a bug called Wuchereria bancrofti, and it infects the lymphatic system, and it causes profound disfigurement and a lot of pain. And there's about 120 million people worldwide infected by this, and we know of about 40 million people that have got severe disfigurements because of it. So there's a huge amount of morbidity associated with that. Then we've got onchocerciasis. This causes blindness and skin lesions. There's about 37 million people infected with onchocerciasis. And the last one I want to talk about is schistosomiasis. Schistosomiasis causes urinary tract and intestinal infections, can cause liver damage, kidney failure, bladder cancer, and there's about 250 million people worldwide infected with schistosomiasis. Now, schistosomiasis is a great example of how it's so cheap to address. If we wanted to provide medicines to prevent schistosomiasis in areas where we know that it's endemic, it would cost about 20 cents per person per year. So basically, it costs nothing. And yet, we still have 240 million people infected with this disease. And to my mind, that's unacceptable. It's a huge travesty, and it's really something that we need to address. Okay, we're going to jump right in. Jessica, talk to us about gaps and barriers to R&D for neglected tropical diseases.
Right, and thanks, Greg, for that good overview of all the neglected tropical diseases. But I also want to point out that not only is access to medicines or development of new medicines for not neglected tropical diseases an issue, they're also just another of neglected diseases that Gloria pointed out as well, and she didn't list all of them, but just saying it's not just the tropical diseases, and it's also important to point out that things like Chagas, even though you consider it a tropical disease, is actually within the United States borders. So we kind of need to think broader when we think about essential medicines and then the global health research and development. So let's get into it. What are the gaps? Well, there are gaps with regard to development, and we talked about the fact that a lot of these drugs are not getting developed for these high-burden diseases all across the world. Now, a lot of this in the gaps come from funding of basic biomedical research and development. For instance, you have 5 to 35 more per disease burden is spent on non-communicable diseases than neglected diseases. And this includes some surprisingly big hitters like TB, malaria, and HIV, which people may not think are actually neglected, but they are in terms of the research that's going into developing the drugs for these diseases. Additionally, the most underfunded neglected diseases in terms of R&D are malaria, bacterial pneumonias, and meningitis, helminth infections, rheumatic fever, and diarrheal diseases. And it's also important to point out that funding is mostly coming from the US, the UK, Europe, and within the public sector. And finally, I just want to mention that this is an important issue that a lot of the funding comes from the public sector, because this is going to be difficult to getting medicine through the pipeline from the bench into clinics, because costs for phase 2 and phase 3 trials are high. And under the current framework, where you have individual government funding labs, that's really difficult for them to kind of take their own research into development. So the responsibility and impetus to develop these drugs lies a lot on the pharmaceutical companies that may not have the incentives to go forward developing drugs for which there's a small profit.
Right. And that's an ongoing problem, of course. Suzanne.
Absolutely.
Yes.
And actually, leading from Jessica's talk, bacterial infections is a reason for 1/3 of neonatal mortality. And the reason I mentioned that fact is that one of the most overseen access to essential medicines gap in research development is in antibiotic research and vaccine research. In antibiotics specifically, there are two issues of excess and access, where overusage of antibiotic resistance leads to need for expensive drugs for treatment of drug-resistant bacteria, which leads to further problems with access, like bottlenecks, delayed entry of novel, safe, and effective antibiotics. And antibiotics are not profitable for pharma. I mean, there's a lack of incentives, especially when compared to non-communicable disease treatment options. And an interesting fact there is no new class of antibiotics which has been discovered since 1987. So that's a huge gap there. Another gap is... another gap is with the research and development in vaccines, where there are two major challenges again, where the gap in affordable vaccine tailored to developing world epidemiology is a problem. There's little incentive again for pharmaceutical to conduct research for diseases that affect countries with limited purchasing power. And then there's gap in research in vaccine stability. Some vaccines are sensitive to both heat and freezing, like inactivated vaccines such as hepatitis B vaccine, influenza, while some vaccines are just sensitive to heat. And thermostability and free stability of vaccines is a very important issue and a huge gap, especially in resource-limited countries where the biggest burden of vaccine-preventable disease is there. 35% vaccines in developing countries exposed to freezing are lost. They're not effective anymore. And
Right.
interestingly, 70% of hepatitis B HBV vaccine is wasted due to freezing. So these are two most glaring gaps in research and development, which I would love to talk about more in the discussion.
Okay, so we
Yeah,
can
and I
address that
think
more in
we
the
were going
discussion.
to talk a little bit more about the innovation for some of those later.
Yeah, and just so that you know, of course, we're going to have links in the show notes for more details, so that if there's information that we can't give during the show, you can read more about it by clicking on the links and going to the web pages and reading about that. Okay, next up, Gloria. Gloria is going to talk to us about a conference that was on last week, the UAEM conference. Gloria, talk to us.
Okay, great. Greg and team, very glad to bring you updates from the UAM Fall Conference, which happened this past weekend at Duke University. Want to thank the Duke University UAEM team and Anthony So, as well as the Duke University Global Health Institute, which hosted us. I'm proudly wearing my UAM conference t-shirt. I hope everybody can see it. Over 250 students were registered and attended from over 10 different countries. This is the premier Access to Medicine student conference, and we've been holding it since 2005. Basically, the whole point of the conference is to convene groups of students and collaborators within the NGO, civil society space, and academic space to promote access to medicines and medical innovations in low and middle income countries, and ensure that specifically university medical research meets the needs of people worldwide. We really want to empower students to respond to the access and innovation crisis here and now. And we've been very fired up since our conference, which I'll do a few quick highlights on the topics that were covered. But breaking news for today, we have our UAM student ask is that patents are an important barrier that we need to address in the cost of medicines worldwide, and universities and the role they play are very important. Breaking news is that UAM received coverage in the Wall Street Journal today. We stood up against a pharma trade group whose new president basically came out and said, no, patents aren't a barrier in access to medicines at all. What are you talking about? And there's been vast research done by many different independent groups that proves that, in fact, patents are a barrier and they do need to be addressed, and we need to think more creatively about them. So I just wanted to give a shout out to UAM and the Wall Street Journal publication today.
Fantastic. Very well done. Very well done. That's really good news. Can someone hit applause? We should hit the applause button for that. Who's got access to applause? Well, we'll just do like a silent clap. Woohoo!
And then just to wrap up very briefly, some of the topics that we covered, UAEM is working on a report card to keep universities accountable with their licensing, which I will cover in future episodes. We also highlighted a lot of our chapter work. Speakers from the Open Society Public Health Program came and spoke about Ebola and its relevance to the R&D gap, as well as speakers on trade and health from India, including Anand Grover, and many other exciting topics, which I hope to cover in future Twig episodes. And I just wanted to highlight that in addition to all of the problems that Sulzan and Jessica very clearly articulated, there are indeed solutions and discussions of new ways of conducting research and development to ensure equitable access in the future. So I look forward to talking about those in later episodes.
Could you perhaps just quickly talk a little bit about the role of universities and perhaps even the role of public-private partnerships like MMV in terms of developing and doing some of the research that's necessary to address some of the R&D gaps for access to medicine?
Sure. So briefly, as Jessica and Sulzan pointed out previously, there's a lot of public funding that goes into the very basic research and development for a large majority of the final public health products that we use, including vaccines, biologics, small molecule drugs. And so our call to these institutions is to say, you hold the power, especially universities, when they take these final products that are developed with, when they take these patents from universities that are developed with public funding, they can say when they license out that patent to other outside groups, including pharmaceutical companies, we'd like you to make this final product available and accessible to people at a reasonable price in low and middle income countries. There's a lot of on nuances and details about that, which I look forward to talking about in episodes to come. But the basic idea there's a lot of public funding that goes into not only the basic R&D, but even tax credits And then further down the pipeline, as we get to the very final biomedical technology, that really gives us a voice. And we should, especially when we're approaching hundreds of thousands of dollars for many very important therapeutics, we should be standing up and saying, hey, you know, let's talk about accessibility and affordability and how we can lower the prices on a lot of these drugs that have a lot of public funding going into them.
Yeah, very good. And just so that people know, we are going to be talking about IP, so that's intellectual property. So we're going to be addressing patents and the TRIPS agreement, et cetera, next week on the show. So that's going to be, and that makes sense in a sense. Like we're talking about the R&D now. R&D turns into intellectual property, and how we deal with that is also obviously very important in terms of the extent to which people can access the medicines. Right, thanks very much, Gloria. Next up, who's talking to us? Jessica. Jessica, talk to us about, is it you? No, Christy. Christy's going to talk about the MSF access points.
Yes, I'm just going to keep this cursory because it pretty much ties to a lot of the concepts that everyone so far has discussed. Gloria mentioned the shift to non-communicable diseases, or NCDs, and then both Jess and Sulzan talked about like vaccines and the need for medicines. So we're going to go over the MSF access document. It highlights 3 points that are sort of not addressed in the global health space. And the 3 fundamental problems with medical innovation, which are more or less motivation, adaptability, and access. R&D is not driven by needs in global health, and where there is little commercial potential, there is little investment, and not many people put in the time or the resources to take care of the issue for necessary meds and technology. And again, as both Gloria and Sulzan said, and Jessica as well, the needs affect both non-communicable diseases and neglected diseases. So it goes into drug-resistant tuberculosis and HIV and malarial medications. Their second point is that the needs for medicines and medical technology is extremely high in developing countries, but many of the innovations do not address the conditions within those developing countries. They don't have the resources. So like we're talking about keeping the cold chain, things along those lines, you don't have refrigeration guaranteed at a lot of facilities, if you even have the facilities. So most advancements are made with developed countries in mind and sort of neglecting the needs and requirements of the LMICs, or low and middle income countries. Last up, even when there is enough profit possible and a development is made, the cost of the medicines, and this is the big point in access to medicines, is that the cost is often too high for people to acquire them. So we're talking about, again, low and middle income countries, and then even in developed countries as well. You look at cancer medication. I mean, that's often hundreds of thousands of dollars, and that's something that needs to be worked on. There's a big price and cost gap between innovation and access that becomes more apparent. So while we've made some progress in access to medicines in the last few decades, many pharmaceutical companies are beginning to engage in the area. We have active advocacy, nonprofit product development partnerships, or PMPs, creative problem solving, and financial investment from private sector. We're still very far from where we need to be.
Okay, thanks very much. Now, something that comes up quite often when we're talking about access to medicines is the idea of essential medicines. And Gloria, could you perhaps just give us a quick definition, or just a quick update? What do we mean when we talk about essential medicines?
Sure. So the very quick sentence is drugs that are not Viagra and male pattern baldness. If you want to get technical, the WHO has a model list of essential medicines that satisfy the priority healthcare needs of a population. It's a guide for the development of national institutional essential medicines lists, and it actually has become a powerful means to promote health equity in individual countries and around the world.
Okay, thanks very much, Gloria. Right, we're going back to Jessica. Jessica, talk to us about ways that we can address some of these R&D gaps.
Sure. Well, actually, I'm not going to get into it right now. There's a lot of ways that we've kind of talked about the public-private development, some other things, research capacity. There's a number of ways, but I want to save that to our discussion because I think we have some more content coming on, and I think Sulzan and I can talk about the biomedical solutions, but also some public health interventions and delivery solutions that need to be thought about when you talk about access to medicines.
Okay, thanks very much. I'm going to ask Katie. Katie has started up a very interesting program, and it's about mentorship. So those of you that you may be one of two people. You may be a person that's new to a career in global health, or maybe you're a young person studying public health or global health, and you're wanting to access a mentor, someone upstream that can give you advice, etc., etc. or you may be, slightly over the hill, but a bit of gray hair. You're wanting to give some advice to a younger person, pass on some of that wisdom. Katie's put together a program that helps join the dots. Katie, just tell us a little bit about that.
I wouldn't say over the hill. That's being a bit rude in my opinion. But anyways, so the mentorship program is something that we started here in Canada about 4 years ago. This is our 4th year that we're doing it. And basically, I don't think, like Greg said, I don't think there's anyone watching the show that would not benefit from this program. So we look for SIPs, which is student or young professional, and mentors. And if you think that you can give some knowledge, then you are a mentor. And if you think you need some knowledge, you are a SIP. And it's really that easy. During the program, we match SIPs and mentors based on their subspecialties and hopefully location, but it's kind of hard with big country, and now we're opening up to international applicants. And basically, we expect that you guys have a few conversations about global health, about navigating your career, and we hope that something good comes out of it. We hope that the mentors gain a new insight into global health, kind of remember the days, maybe learn something new about global health because they may have learned differently a few years before. And we hope that the SIPs gain some guidance. Global health is a notoriously windy path, and I think we've talked about this before in some of our episodes, and it's really overwhelming for new people. So just to kind of get a direction, ideas of where you could go, what you could do. So we are actually have the applications open right now. The program is called MentorNet, or CSIH MentorNet. The website is csihmentornet@wordpress.com. We're also at mentornet_CSIH on Twitter, and Facebook group is called CSIH MentorNet. And the applications are actually open until November 30th at midnight time, Eastern Standard Time. So we'll put all these in the show notes. But I encourage everyone to apply. It's a really, really great program, and it's been going for 4 years. We only get bigger and better.
And just really quickly to add to Katie's, I think that what she and MentorNet are doing is one of the first steps that you really need to take to succeed in global health, which is finding somebody to mentor you. It A, helps you sort of get your foot in the door, and B, is helping you sort of overcome one of the biggest obstacles in getting started in a career, which is finding somebody to get to know, to lead you in a certain direction with research, and maybe even advocate for you. So it's going to be a wonderful program. Great work, Katie.
Thanks.
Excellent, fantastic work. Before we end the show, Sulzan has a shout out. Sulzan, who are you going to give a shout out to?
So I'd just like to thanks to our Twitter viewers, to our Twitter viewer at Monkey Mind, and our Twitter viewers Merit Basie, who's with 100 campaign for controlling non-communicable diseases, and also to our Twitter viewer LEK at LEK100 campaign. So I'd just like to say thank you for watching this show, and we'd love to hear more feedback from all of you.
Great. And Merit is also from UAEM. She's our new executive director, as well as part of the 100 campaign. Great.
Now, anybody who has questions about content on the show, or if you want to ask us questions for when we go into the discussion, please go ahead and you can send us an email at hello@twig.org, or you can go on Twitter and find us via the hashtag TWIGH. We are also on Facebook as This Week in Global Health. So there's a ton of different venues on which to reach us and interact with us. So please do, because we're here to answer questions and have a dialogue.
Yeah, so I think this is where our live portion ends. We've lost Greg, but with his absence, I will end as he always does. Don't ever change. Don't do drugs.
Stay cool.
Good night. Wait, there he is. No, Greg, no,
You left the most important part out for the young demographic.
No.
What? Wear a condom? That's
oh my God!
Hey,
okay, thanks for watching. If you're watching this live, don't go away because we'll still do questions.